Welcome everybody to the next edition of In the Interim. I'm Bruce Mueller, I'm the Dean of the College of Pharmacy, and I'm really excited to have this episode of In the Interim with a recent graduate of ours, Tracelyn Freeman. In the Interim is a program that we've put together. It's kind of a funny time with COVID and everything else. And usually we bring a lot of VIPs into the College of Pharmacy to allow for some networking opportunities with our students. But we're not really allowed to have that much travel. So we put together this In the Interim program so that we can bring really important people from all over the country to come and meet and talk with our students. And this is no exception this week. We've got Tracelyn Freeman, who comes to us from a school down south that's difficult to name, that happens to be in Columbus, Ohio. Yes, she's at Ohio State. In fact, Tracelyn started at Ohio State. She got her Bachelor's of Sciences in Pharmaceutical Sciences there, and then saw the light and came to the University of Michigan, where she received her PharmD. She has done 2 residencies, a PGY1 and then a PGY2 residency in oncology, and now currently works down in Ohio State as a pharmacist specialist in malignant hematology, and she takes care of patients with various types of leukemias. So with that introduction, I want to say hello, Tracelyn. Welcome to the program.
Hello. Thank you, Dean Mueller. Thank you so much for having me.
Love to have you. I'm trying to picture what that is behind you in your photograph. What is that?
Since I figured I would share a picture of Ohio State because we love it so much.
Oh my gosh. I'm looking out my window, I'm looking at snow, and it's that nice in Columbus, Ohio right now.
No, this is a picture of the James Cancer Hospital behind me. And I like the picture of the flowers too, as I wish it was springtime instead of winter time right now.
I do too. But that's all right. Well, we can't meet in person, but I'm glad we're getting a chance to catch up. It's been a little while since we've talked to each other, so I'm so glad to have you here. And so what's your current position now?
So my current position is working as a specialist pharmacist in hematology, and within that, primarily working with patients who have leukemia, and also I work in cellular transplant and work with patients receiving autologous transplants and other types of cellular therapies such as CAR-T, and also working in patients with clinical trials.
All right. Well, that sounds great. We have a huge audience tonight of pharmacy students, staff, and I think we have some pre-pharmacy students. We got a big crowd tonight. And so what I want to say to the crowd is, if you've got questions, go ahead and put them in the chat, or later on, I'll open up the microphones. If you want to ask questions to Tracelyn directly, you can do that as well. So I want to make sure that we have all our questions answered. And so Tracelyn, in today's world, what is it like, with all the COVID, and you've got an immunocompromised population? How is patient care different now? When are you doing active rounding and all that kind of thing?
Yeah, well, it's definitely been a transition, that's for sure, because I think in the earlier stages of the pandemic, we were kind of figuring it out just like everyone else was. And so when I was finishing up my second half of my residency, a lot of that actually was working from home for the first few months of the pandemic. And then towards the end of that, I came back on site and started rounding in person again, but it looked a little bit different. We now have a WebEx, or like a conference call that we use for all of our rounding. So for people that aren't able to attend in person, we have a phone option available, which we didn't really utilize before, but now that's something that we depend on quite heavily. And also in clinic, I think that looks a little bit different too, particularly when it comes to even as simple as how many visitors are allowed with a patient for their regular clinic appointments. And that's definitely changed over the months too, and the various restrictions that we've had. And so I think it's definitely something that continues to change, and it looks very interesting and very much different now than it was a year ago before all of this. And I think especially working in an immunocompromised population, we have to really be cognizant of the various protocols that we have in place because of our patients and their acuity. But I do think that there's a role for pharmacists to be involved in that as well. So it does make it interesting for the role that we play.
Did you always know that you wanted to be in hematology oncology?
For quite a while, surprisingly, I was thinking about this the other day, and I think I first realized I wanted to go into hemonc when I was an undergrad. because I was a BSPS student at Ohio State, and I took a pharmacology class and really gravitated towards the cancer module. And I just found the science of it all to be so fascinating. And then throughout pharmacy school is when I really started to explore a little bit further what the patient care aspects of that might look like, and really just continue to fall more in love with it as I learned more about it. And so I started to explore it, I think probably in undergrad, but solidified my interest in pharmacy school.
And when you say explores, we have a lot of students on now, some of our BSPS students themselves and many pharmacy students. What does explore mean? So what did you do to figure this out as a student?
Yeah. So I think when I was first getting into things, I really just wanted to see what opportunities were out there and available for me. And so I remember the very first exposure that I had to pharmacy that was consistent was working as a hospital volunteer in our central pharmacy. And so our central pharmacy dealt with primarily the operations of many of our units inpatient. And so I was able to learn a little bit about that process and the role that pharmacists play, the role that technicians play, the role that interns play. Like I can kind of see like kind of how all that worked together. And so my role as a volunteer really would be to help support part of the operations in terms of unit dose dispense and deliveries. And then when I went on to pharmacy school is when I secured my first internship. And that luckily happened to be at a cancer hospital. And so that was kind of where I was able to get a little bit more of my exposure to the patient care of taking care of patients with cancer. And so I think that's kind of where I was able to see things from that angle. And I think the other part of my exploration outside of patient care probably came from research. I think one of the strengths of the University of Michigan pharmacy program is the PharmD investigations. And my PharmD investigation was in the area of stem cell transplant. And so I think that helped me really explore kind of what the research aspects of cancer care was all about. And I think that is what a lot of people may gravitate towards when it comes to HEMONC, because so much of it is constantly changing and evolving. And I think that is what makes it exciting, and really the opportunity to be on the front lines of a lot of the care that we're providing, is a lot of it is housed like right where we're practicing. A lot of the clinical trials that we're participating in, we're a participating site. And so something like that is just really cool to think about when you kind of step back and look at that whole picture.
Right, oncology has uh,
Yeah.
so much investigational drugs and all those sorts of things, and the oncology world is just does a great job of enrolling patients into trials all the
Yeah.
time, and so
Yeah.
you've really got to be on top of things. So I guess it's good to have the research background. Eh,
Mhm.
when you mentioned some of the therapies you were working on, you talked about CAR T and some of these other things. I'm not sure everybody on the
Yeah.
call here knows what that is, but do you ever like that is super expensive therapy? Do you ever think to yourself the other day that you just spent $1 million while you were
Yeah.
on rounds today?
Yeah, it's so funny that you bring that up because of some of our therapies being so expensive, there's actually a certain process that we go through in terms of approval. And sometimes I'm even scared to just send that email to my manager to ask for a therapy that's so expensive. Because when I like have to put the numbers in and like figure out like, the estimated cost of therapy is like X amount of dollars and like
What's
zero,
X?
zero,
What's
zero.
X for the audience? What is X for some of these?
Like at least like for example, like let's just say one vial of therapy costs like $10,000, but then you need three of those vials for one dose. And then let's just say that patient gets that dose once a month. And so then if you're thinking about, okay, well then if that is one dose given once a month and that 1 month is one cycle, and we're thinking that we're predicting X amount of cycles, well then how much money is that going to be at the end of things? And so it adds up really quickly. And it's crazy to think that therapies cost so much money. You wonder like why and how does it cost them as much as it does. But I think that's also something that is important to talk about patients with, because we definitely do play a role in that decision making process and weighing the risk versus benefits and trying to bridge the access to care, because unfortunately so many of our patients may not be able to afford certain therapies, and that's why we really work so well with our medication assistance teams, and they work magic sometimes, and they're able to get therapies for our patients that I didn't really know would be possible. And I think that's just a beautiful thing to see that come together when it does. And so it really is a full team working on all of these therapies for these patients.
we have a student group too. Dr. Shauna Kraft has this song group where they're trying to find ways to get some of these medications paid for. It's
Yeah.
a great experience. And actually, a lot of our students work in that group to try to make that happen.
Oh,
So,
that's
you don't
awesome.
mind maybe spending the money, but you got to make sure you're spending it right. It seems like that's a really
Yeah.
important role of the pharmacist.
Yeah, definitely.
You got to use it in the right people and not in the wrong people. So if you're going to use it, you want to get your bang for your buck,
Yeah,
in all of this. Yeah.
exactly.
So how long have you been on the job? Not as a resident, but job.
On the job for about 5 months.
Okay,
Since
so
August.
that's why I wanted you on this year
Yeah.
because you're fresh
Yeah.
out. You've gone through the process, and we have
Yeah.
a lot of fourth year students right now going through the interview process for
Mhm.
residencies and trying to get prepared for that. And you did the first year, which is a PGY1, sort of a general hospital clinical residency, and then you specialized in the PGY2 year. Why don't you talk us through a little bit of what you did to prepare? What do you think was a good thing to do to prepare
Yeah.
for the residency and job process? Because we've got P1, 2, 3s, 4s on this call now.
Yeah.
Like what can they and should they be doing now to get ready so they can have a cool career like you've got?
I think that's a great question because I think there's multiple ways that you can prepare for a residency or whatever it is that you want to do after pharmacy school. And I think that there's a lot of different ways that you can approach it. For me, the route that I took, I really wanted to tap into leadership. And I really found my purpose to be involvement in various student organizations. And so I did that throughout my pharmacy school and was involved in a few different organizations that I would say were pretty different from one another, so that I would hopefully be able to develop certain skills based on the leadership role that I held in a certain organization and be able to apply that forward. And I think that also was helpful for me because I was able to use a lot of those examples and scenarios for interviews and writing application questions, and just being able to kind of tap into the different experiences that I've had and the diversity of those experiences. And so I think leadership is probably one big pillar that I would say can help prepare you well for residency, because also depending on the type of leadership role that you may hold, you also can be developing skills that you don't even realize you're developing at the time. For example, something like time management. I know we probably talk about that all the time, but it definitely is a topic that does not go away in residency. And something like being in an organization and also balancing your schoolwork and maybe a job as well definitely will require being able to have a good balance of things. And that's a strength I think that they will look for in a future resident as well. And so I think you can also use examples like that to speak to those strengths too. And so I think for me, I really try to be a leader in the various roles that I held. And I also want to take the time too to mention that leadership looks different for every person. It doesn't necessarily mean being the president of an organization. You can really make a leadership role out of anything that you're doing. And I think that also ties back to what you believe your purpose to be in the organization that you're serving in. And so I think it's important to just keep that in mind.
That's great advice. I mean, and not everybody can be or should be the president, and you don't have to be.
Right. You
And you
don't
also
have to
don't
be.
have to belong to four organizations. And do one or two things. Do it really well. Lead an event, or do
Yeah.
one thing and do it really well, so that you've got some stories to tell when you're in that interview process. I think that's important. Did you work your way through school? So you did some leadership, and you also had this internship at was that
Yeah.
at Carmanos Hospital?
Yep, it was at Carmanis. Yep, I had
Yeah.
an internship starting the summer before my second year of pharmacy school, and then I held that longitudinally through graduation.
Well, talk to me about this time management, because you're working, you were an active student. Um,
Yeah.
you must have got at least good enough grades to get through the process. I don't remember, but so tell me about that time management. How do you do that?
It can be tough at times, if I'm being honest, especially when you're in the moment, because sometimes you feel like things are just piling up and you don't exactly know how you're going to handle everything. But then you find a way somehow, and then you look back and you're like, wow, like I did that. Like, I was able to like make it through that time. But like when you're in it, that's probably when it seems the hardest. And so I feel like for me, looking back on those busiest times of pharmacy school what helped me time manage well was actually also leaving time for things that didn't really have anything to do with pharmacy school and were more so things that were important for my self-care or my mental health, because I found that if I was able to attend to those things and be in a healthy place from that perspective, then I was able to be a more effective intern or a more effective member of an organization, or even a more effective student. I think kind of being able to devote that time and protect that time for the things that you maybe have a hobby with or that make you happy, things that you were doing before pharmacy school. For me, for example, that was playing the piano. And so that was something that I really enjoyed doing. And I tried to stick to that throughout school. And that really helped me kind of stay grounded. The other thing that I think helped probably best with my time management was writing things down and keeping some sort of planner or like a calendar. Kind of for me, my tactic, I think, is if I can see it on paper, that automatically makes it a little bit more manageable and like makes it a little bit more feasible, as opposed to just having a bunch of different things that I need to do like floating around in my head. If I can like actually see it written down, I can like tackle it a little bit better. So that's just something that I found that works better for me.
Well, the time management thing happens to deans too. I will tell you, there's too many competing priorities. But like you say, somehow you get it done. I don't know how I'm going to get it done, but
Yeah.
same situation as you. I don't know if it's been your experience, but I remember being like a P2 student. It's like, gosh, I'm working as hard. Actually, when you're an undergrad, well, I'm working really hard. I don't know how I could work harder. Then P1 year comes and goes, oh, I'm working way harder now. And P2,
Yeah.
wow, even more. P3, and honestly, P4, I found easier, but I know I was working probably harder and more hours, but it was kind of fun. You're on
Yeah.
rounds, you're doing great stuff. And then let's talk residency. What
Yeah.
was so your residency both were at Ohio State?
Correct. Yeah, both
Okay.
years.
So residency, I mean, everybody says they want to do a residency, but that's a lot of sacrifice too. Right? Why don't you talk about what's it like being a PGY1 resident?
It's a unique experience because uh, busy is definitely a good word to describe it, because I would say you're not even always doing something new. It's more so just doing things in a slightly different context. And so, like, you have rotations as a P4 student, you have rotations as a PGY1 resident. But now, as a PGY1 resident, there might be more that's asked of you, there might be more that's expected of you. And also at that time too, you have to give yourself credit that you know more as a PGY1 resident than you do as a P4 student. And so you're able to perhaps contribute in a way that you hadn't before. And so I think the patient care aspects are still there. It just may look a little bit different. But I think the patient care part of PGY1 year is definitely probably, I would say, one of my favorite parts of residency, because I felt like I really had those feelings of being a valuable team member. Like I felt like I had various times where I was able to contribute to the care of a patient or the discussion on a patient. And I felt like what I said or what I recommended really was valued. And I felt like I was really a good team player in those scenarios. And I think that those parts of residency are the most rewarding, because you definitely will have times as a PGY1 resident where you're busy with your research project, you're busy with staffing on the weekends, you're busy with teaching or whatever else you may want to tap into depending on your interest. And so you can definitely get bogged down at times with all of that that's going on. But then if you think back to like those moments where you felt so fulfilled and you felt that rewarding moment where you were able to contribute to the team that you were working with and they were very grateful of you being there, that was an awesome feeling to me. Like I remember I had an example one time where I think I had to be like a half hour late or so to rounds because I had something else going on before. And I told my team that I was going to be late that day. And then when I did show up, they had said a comment like, "Oh, we're so glad you're finally here. We have so much to ask you." And so just to think about like how you're able to help your colleagues in those multidisciplinary interactions, they're so significant. And so I think that really is why a lot of us are doing what we're doing, is for those moments that we're really able to impact patient care that way.
So I remember my father when I said I was going to do a residency, and he said, you must be bad at math because you're going to make half the wage, probably ish, and you're going to work. What's a legit amount of hours a week, do you think, if you average it out?
Well,
60?
I would probably say a 40-hour work week where you're on site every day, and then plus or minus the hours that you would put in the evenings to prepare for topic discussions or to work on your research project and things of that nature.
And then are you working every other weekend at Ohio State or every
We were
third
working
weekend?
every other weekend. We worked,
Every other.
well, my first year we worked every other weekend. And then my second year, I think it averaged out to about every third, but the weekends were a little bit more scattered throughout.
And so maybe for the audience, could you contrast what your PGY2 experience is and how it's any different than PGY1?
Absolutely. So with PGY 2 year, that most of the time at least is all about focusing in on a certain specialty. And so I think one of the great things about the pharmacy profession is there's so many avenues that you can take to get to so many different places. And I think the same is true for clinical pharmacy practice as well. And so as you probably have already seen or will see, there are a lot of different types of PGY2 programs in various specialties. A lot of times will correlate to various rotations that you may have already had. And so one PGY2 program that's available is in hematology and oncology, which is the one that I completed. And so with my PGY2 year, it was much more focused. And so instead of having a year long's worth of rotations that were in different disease states and in different specialties like solid organ transplant or cardiology or pediatrics, all of my rotations were in a hematology or an oncology disease state. And so you might be wondering then, well, like, how can you like have a whole year just dedicated just to that one thing? And I was surprised. I was so surprised to just learn how many cancers there are that are out there. Like, to be honest, probably could use 2 years of PGY2 in hematology, and because of just all of the things that there is to learn that you can't possibly fit it all into one calendar year. And
But
so,
the thing I always think about oncology is what's neat about it is it's a small it's not 100% oncology because you've got to be great on infectious disease because you've got immunocompromised hosts, you've got nutrition, you've got pain. People
mhm,
with diabetes and hypertension still get cancer. And so
yeah,
you actually have to be a fabulous clinician.
yeah,
Cancer, I always thought is like a small part because really they're not often going to say, Tracelyn, which 3 drugs should we use for this particular, should we use the CHOP regimen for this? Like, that's not
yeah,
what it's about, really. It's
yeah.
managing side effects and dosing for renal disease and sort of almost predicting what the future is going to be and doing a lot of patient communication.
Yeah, it's all of that, especially depending on where exactly you're working. The cancer team, so to speak, is the primary team on an inpatient hospital service. And so, like to your point, we're managing the entire patient. And so what brings them to our service, yes, might be their cancer disease stage and their primary diagnosis of, but they may have several other comorbidities that we're managing at the same time as well. And we're serving as the primary team. And so we're not the consultants on that. We're managing that just as much as we're managing their actual cancer disease. And I think a lot of times what I've learned in my last year as my PGY2 year is, from what I've learned, at least, the treatment of a lot of different types of cancer is actually moving more into the outpatient setting, more
Right.
into the ambulatory care setting. And so I really think if you have an interest in inpatient and outpatient, that's a great specialty for you to get exposure to it all because you can work in all types of those parts of the process. A lot of times, patients that are being admitted to the hospital might be due to the acuity or a new diagnosis, a new diagnosis, or it could be management of various symptoms that they might be experiencing due to the treatment that they're currently receiving. But a lot of the actual care, like cancer care that we're providing, is moving to the outpatient setting as well.
Right. So I've got lots of questions rolling in here. So we're going to have to do this rapid fire so that we
Okay.
get into the time zone.
Yeah.
Okay. So here
Yeah.
we go.
Absolutely.
So here's a question. You jumped right out of school and went right into the residency. Someone has asked, what do you think if you'd have waited and then, worked for a while, and then gone to the residency? Would it have been as easy or would you recommend jump right into the residency?
I think that's a great question. And it's a hard question to answer because I think it depends on the person. I think it depends on exactly where you are at that point in your life and what you think the best fit is for you immediately following graduation, because people do both. I personally went right into residency. I would say partly because I had an interest in hemonc and I knew that that was likely what I wanted to
You knew your
pursue.
path, is what
Yeah,
you're
I knew
saying.
that path, and so I wanted to like continue with that and keep that momentum. However, I do think that there is value in taking time from graduating and perhaps working a little bit if you want to continue exploring several different things and you're not quite sure where you want to go yet, or if you want to just get more of the work experience to help you navigate that decision making process. I think that that is certainly reasonable too. I actually, some of my co-residents did that very same thing. And like I was saying earlier, I think that alludes to the importance of understanding that there often is more than one path to get
Right.
to where you want to go. Like whatever you think your end goal may be, there's not one set path to get there. You can even make your own path in a lot of cases.
About every other year, we have somebody who waits a year and then jumps back in. So
Yeah.
that happens. But also remember the PGY 1 year, the residency is a general broad based where you get to do some exploration as well. You don't have to know. I mean, not everybody's Tracelyn who knew, as an undergrad that she wanted to be in oncology. It's kind of unusual.
Yes. No, yeah, your PGY 1 year, I think, is a fantastic time to explore because you
That's right.
move month to month in different specialties essentially, in those disease states too. And so your PGY 1 year is perfect time for that
All
too.
right, next question. Rapid fire. We gotta go faster. We're never gonna get these all in. You ready?
I'm talking too much. I'm
As a
sorry.
pharmacist, what do rounds look like? For someone who's never been on rounds,
Yeah.
what's your role? Like, why do they need you there?
Yeah. So it's a multidisciplinary setting, most likely. And so that means that in addition to pharmacy, there will be the medicine team. A lot of times there will be social work. And something else is a role that I learned that I didn't actually know much about as a student is a patient care resource manager or a PCRM. And a lot of times they are crucial to coordinating the disposition of a patient and the post-discharge care. And so, in my role as a pharmacist on rounds, we really are the experts of the medications that the patient is on. And anything that's medication related, a lot of times they will start to just look in your direction and ask you this question about a medication that they might have came in on, they were taking prior to admission, or that they might want to start while they are in the hospital. And so I think the pharmacist in rounds really is kind of driving a lot of that knowledge that's being discussed in regards to the medications. And so I think that it's nice to be able to offer that skill set to your
Well,
team.
we already know you're indispensable because they don't even want to have rounds without you. So that goes without saying. Talk to us a little bit about in your path. Were How helpful was the University of Michigan alumni or faculty to prepare you for residency?
I think extremely helpful because I learned quickly that a lot of times those connections that you're making are so critical, and you never know who you're meeting that will help you later on in your path.
Are there
Um,
specific ones for you
yeah,
or
like
experiences?
for example, when I was actually looking for an internship, P1 year, I knew I had an interest in cancer and working with patients in hemonc, but I didn't really know like where to go from there. And so I learned about that internship that was available at Carmanis, and I remember it was Dean Mason who reached out on my behalf to the pharmacy director at Carmanis and just kind of mentioned that she had a student that was interested in this and to see like if the opportunity was still available. And I think it was because of that connection that Dean Mason already had with that pharmacy director and her helping me, that was what kind of got my foot in the door. And so I think just being more vocal about what it is you're looking for and just seeing if there's anyone out there that can help you. You just never know who knows someone about something
You're 100% right.
or
But
working.
if you wouldn't have told Dean Mason, she wouldn't have known to reach out. And so,
Yeah.
the faculty can be your best friends. I know they seem scary, and nowadays they're on Zoom. They seem really scary. But if you don't tell me, I can't help you. And I'm in this business
Exactly.
to help. I would go be doing something else if I didn't actually want to do that.
Exactly. That is my point. That you really, if you there's something that you're interested in, even if you have a budding interest and you just don't even know much more than that, just throw it out there. Just mention it. Like, hey, like I'm thinking about this. I don't really know much more, but where can I go from here? Do you know anybody in this field, or have you had previous students that had a similar interest, and can you connect me with them?
Right.
That's something that I'm always willing to do is if there's anyone that's even remotely interested in HEMONC, I like, oh, like, let me talk to you about it. Like, let me tell you what my experience has been like. Let me answer any questions that I have for you. And since I'm still fairly new, let me connect you to my mentors. Like, let me connect you to people that might be able to provide more of that experience. And so I think a lot of that in pharmacy is just kind of putting yourself out there. And there's always going to be somebody there that knows someone or can at least set you in the right direction. I think that network is so important.
All right, more questions. Everybody's interested in the residency part of this, so I'm glad we have you. Uh, what part of your residency experience surprised you, or did you feel unprepared for? I'm hoping you felt prepared, but maybe you didn't feel prepared for residency. But
um, I would say probably one of the most uncomfortable experiences in residency was responding to codes for me because it is just not really my personality to be in that kind of environment.
so
And
explain. I mean, code blue environment. Yeah,
yeah,
I know. I was the same way, man. It is
a
just
code
different.
blue environment, it still kind of makes me a little anxious. I do respond to them now, even as a specialist.
And what's
And
your
every
role? So talk
time,
because other people haven't been on. It doesn't. They never show the pharmacist on TV in a code, by the way.
no,
So what are you doing?
so we are by the crash cart most often and pretty much are responsible for everything that's in there. And for those of you that may not exactly know what all is in a crash cart, there's the medications that you can pull up at bedside and give right then to the patient. Then there's also a bunch of supplies in there that nursing may use. And so for me, kind of being in that environment, it's very high paced. It can change very quickly, very high stress. And for me, I think I tend to have a workflow that is a bit more calming and I like to think things through a little bit more.
Codes are not calm.
And codes are kind of the opposite of calm.
Well,
However, though,
we teach everybody to make these sterile products in a hood. It's also nice. And the next thing you
yeah,
know, they're saying, drop an ampule of atropine
yeah,
or, whatever, make a
yeah,
bag of dopamine or whatever it is. And you're going as fast as you can.
yeah, I know.
And you have to
Exactly.
be accurate. And
Yeah,
that's
you
so,
have to be accurate. But I would say I did go to a few, I didn't go to a ton of codes, thankfully, but I did go to a few. And after I went to like the first or second one, and then I was like, okay, like, let me like prepare for like the type of situation that I'm getting ready to walk into. And so I think I kind of learned like how to kind of expect and anticipate those type of situations a little bit better. So I think that helped.
all right. That's a good answer. I hadn't thought about that. That's a great answer, actually. Oh, I got one more question. And if the audience has more questions, the Q&A or chat, I can get you either way that way. Uh, Real good question here about when to make your decisions if you want to do a PGY2 or not. I know that for even the PGY1, we have P4s who told me at the beginning of the P4 year they're never going to do a residency. And then along comes November, they say, I think I want to do a residency because I really had a great experience in my fourth year on my whatever infectious disease rotation. But
Yeah.
in the PGY1 year, like when do you have to make a decision if you want to do a PGY2 or not?
So I think it also depends on the process of early commitment. And so that is in the programs that offer it, where you may have the opportunity to commit to a PGY2 program at the institution that you're currently completing your PGY1. And depending on what their early commitment process looks like, then you may not have to go through the formal match that would then occur in the spring. And so I bring that up because that then kind of pushes up the entire timeline. And so if you, for example, are considering an early commitment to a PGY2 program, then that decision actually comes up pretty fast. And it kind of surprised me as well, because when I was a PGY1, I was making the decision for early commitment for PGY2 in October.
October. I was going to say it's
Yeah,
October. Yeah, it's
in
early.
October. And that I started my PGY1 in July. And then July often is your orientation month. And so you don't
So you're
have a
not even
rotation
rounding then.
then.
That's
Yeah. And
right.
so you're not starting your rotation probably then till August. And so that's probably two full months or 2 full rotations, and then they're probably already talking to you about early commitment. Now, if you don't want to early commit, of course, that's an option too. And so you have a little bit more time to
And
explore
early commit means you have
elsewhere.
to stay at the place you're
Stay
at
at
to
the
do the
place that you're
PGY2.
at.
But remember, most residencies don't have a most residency sites don't have a PGY2,
Yeah.
probably what you're interested in. So you're gonna have to go to a different institution. So early commitment won't be a thing. All right, I got one more question here. This is for our students who are earlier in the trying to decide, what does a residency really do for your career? So I'm going to guess, I'll just say you probably couldn't have your job you have now had you not done the PGY1, PGY2
Correct.
process, because you wouldn't be qualified. But what, in general, if you were advising a, P1 or P2s thinking about this, what does a residency do for you? What do you get
Yeah.
out of it?
I do think that it really broadens your knowledge in just a more accelerated path, because I don't think that it's impossible to attain the same level of clinical skills and knowledge that you walk away from a PGY1, PGY2 with in working in practice without a residency. I definitely think that that is very much attainable without a residency experience. I just think a residency accelerates that path, because you are, I think, at last I heard, at least, I'm not sure if this is still accurate, you can correct me, Dean Mueller, but a year of residency is equated to like 5 years
People
of,
always say that, right?
people always say
But the
that.
reason is because you can dedicate your time on learning. You're not spending all your time, making IVs or
Yeah,
doing some of the other things that a pharmacist does. It's all about the learning, and that's why I think it's accelerated.
yeah.
Well, I want you to have the last word here. Anything you want to say to the audience, or can people contact you if they've got questions, or what kind of questions you'd like to answer besides how to go to Columbus, Ohio, because you can't answer that question.
Yes, definitely. Please contact me. I have my email address that I think will be made available to you all. And so please use that. I'm on my email all the time. And so I will definitely try my best to get back to you in a very timely manner. But please send me any questions that you have, residency related or not residency related. I'm happy to serve as a resource in any way that I can. I really love these events that you all are doing. I think this is excellent. And so any way that I can be a resource to students that are on their path to becoming what they want to be, I definitely want to try to help them in any way that I can.
Wow, Tracelyn. Well, thanks. I want to thank you for being on the program and kicking off this semester's program. You're on the screen right now is your contact information and your email address.
Yes.
And interestingly enough, Tracelyn, next week we are going to have another OSU connected person, believe it or not. Andre Harvin
Oh,
is going to be
no
coming on.
way.
You know Andre. And so he's
Yeah.
going to come in, and we're going to talk about, he's done a lot of different jobs. So somebody who's done a lot of different jobs, but is frontline on COVID right now out in North Carolina. And he's got a lot of things he wants to talk about. And I met with him this week to pre-meet. He's really excited about coming on. So those of you interested in learning about how to be a director of pharmacy, how to work in pharmaceutical industry, he's done it all in his very young career. But he also is connected to Ohio State. What was the matter with me this semester? I don't know what to say. Tracelyn, thank you so much for being on the program.
Thank you
It was a
so
great time.
much.
Thank you, audience. We'll see you next week.
Thank
Monday.
you.
It's Monday next time at 5:30. See you, Tracelyn.
Bye-bye.
Thank you so much.
Take care.